Together we achieve victory over heart failure.
Hello and welcome to our podcast. I am Dr. Deepak from Satyasai Hospital, Bengaluru. And today we are delving into a silent epidemic that India is combating is a heart failure. In India, the majority of the patient is grappling with the heart failure are surprisingly young individuals. It's a common occurrence into witness young adult seeking medical assistance for the heart failure. Unlike the Western countries where the heart failure is predominantly disease of the elderly. Let's break down the 5 essential insights on the heart failure. Firstly, what does it mean when the doctor tells you that you have a heart failure? When the people get a diagnosis on the heart failure, they think it's the end of their life. The term heart failure can seem threatening, but it just simply means the heart is struggling to pump blood as efficiently as it should. The ejection fraction or the EF measurement, how well your heart is pumping blood. It's a amount of the blood that is pumped of your heart lower chamber is a ventricle that each time is its contraction. While a normal EF is around 50 to 70%, but in individual with the heart failure typically have an EF is 30% or less. The second, why are so many Indians affected by the heart failure? The genetic play a significant role. Indians are the genetically more vulnerable to cardiovascular disease. Furthermore, hypertension, diabetes, obesity, smoking, and the habit worsen this the epidemic. Moving on, what are the signs and the symptoms of the heart failure? Watch out for the confusion, fatigue, heart palpitation, nausea, shortness of the breath, and the weakness. There is also a loss of the appetite or the vomiting. How can we protect ourselves from this disease? Our heart is work incredibly hard to keep us alive. There are the 5 golden rules that can be followed. The early detection of the heart failure through the regular blood checkup or maybe the ECG and the echocardiography. The daily adjustment to maintain the health care and incorporating daily exercise in your routine and practicing the stress management technique and the quitting the alcohol, tobacco and smoking. Lastly, what comes next after the heart failure diagnosis? Then treatment. The thankful medical science offer the numerous treatment options. It is possible to lead an enjoyable, meaningful and the productive life. So the heart failure medication improve the quality of the life and the longevity. And the device like biventricular pacing, implantable cardiovascular defibrillator and the heart valve or the replacement. And the last resort is the treatment option is the heart transplant. Lifetime risk for the CHF means congestive heart failure in 1 in 5 or both men and the women. Remember, awareness and the proactive measurement are likely in the combating this silent epidemic. Thank you.